Stephen Donnelly.
The bill before the House amends the Health and Social Care Professionals Act 2005 to provide that any non-Irish health professional qualification that was recognised in the state prior to the introduction of the statutory registration at the Health and Social Care Professionals Council, or CORU, will not have to be re-recognised for the purposes of registration under this Act. Now, it pertains to a wide range of health and social care professions. The 15 professions currently recognised under the Act are clinical biochemists, counsellors and psychotherapists, dietitians, dispensing opticians, medical scientists, occupational therapists, optometrists, orthopists, physiotherapists, podiatrists, psychologists, radiographers, radiation therapists, social care workers, social workers and speech and language therapists. So a very valuable and important group of people for both our medical system and indeed our social care systems. And essentially the bill provides a new route for non-Irish qualifications to be recognised and for the practitioners to therefore be allowed to use their professional titles if, prior to the creation of the new statutory registration regime, the foreign qualifications were recognised by the Minister or bodies acting on behalf of the state. They will still be recognised without reassessment being required by CORU. As such, those practitioners will be allowed to use their professional titles. The Health and Social Care Professionals Act of 2005 was an important piece of legislation in terms of providing quality control, registration, protection for the public in the context of this wide range of services. And up to this point, or up until 2005 indeed, only doctors, dentists, nurses, opticians and pharmacists were subject to the statutory registration. That was greatly expanded in 2005 and supported by the establishment of CORU, which also promotes professional conduct, education, training, competence and more. So a very important body doing very important work. Minister Fianna Fáil considers the amendment to the bill to be sensible and we will be supporting the bill on its way through. Now, while the bill is largely technical in nature, and I think you referenced that yourself, Minister, new routes to professional recognition, once deemed safe and appropriate, obviously, are to be welcomed, because we are running out of, or are desperately short of, a lot of the professionals who are referenced in this bill. The bill covers radiographers. I was contacted by a colleague who was contacted in his constituency in Kildare by GPs saying they no longer had direct access to DEXA scanning. So DEXA is the bone density scanning, very important scan, and GPs are able to make direct referral, not in all hospitals, but in a lot of hospitals. So we submitted a PQ on the issue, and I got a letter back from the HSE. This was from Naas General Hospital, and it said, "Dear Mr Donnelly, I wish to acknowledge receipt of your letter on DEXA scanning. At present, the DEXA service to general practitioners is suspended due to a national shortage of radiographers. The hospital is making every effort to fill the current vacancies." And hospitals and radiographers, and indeed the consultants and the doctors and the nurses who work with the radiographers will tell you the same thing, that we can't get them. And one of the things, of course, we need to do is we need to open the diagnostic suites more. So there's a massive backlog of people waiting for diagnostics, a massive backlog. And one of the things we need to do, we have the machines, and in some other countries you'll find they open the diagnostic suites 24/7, or from 6 in the morning till midnight, 6 days a week. Now, typically we don't do that. Typically our hospitals open them sort of 8 to 5, Monday to Friday. It varies a bit. But when you talk to the hospital managers and say, what is the reason you're not doing more of this? They don't say we don't have the machines. They don't say we can't bring patients into the hospital. Indeed, when you talk to patients who say, yeah, look, I've been waiting months for what could be very important scans, you say to them, well, would you mind going in on a Saturday? No. Would you mind going in on a Sunday? No. Would you mind going in at 7 in the morning? Would you mind going in at 9 in the evening? They say, no, of course not. We need the scan. What they'll all tell you, what the hospitals will tell you, what the nurses will tell you, what the doctors will tell you, is we can't hire the radiographers. Very, very serious stuff. In terms of children with special needs, I think The reference here to occupational therapists, speech and language therapists, is just worth reflecting on. I took a look at a few of the waiting list, Minister, just in preparation for this evening's session. So there's both men, women and children waiting for speech and language, but a lot of the people waiting are children. There's a lot of adults as well, with acquired brain injury, with stroke, with all sorts of things, but a lot of the people waiting for speech and language in your constituency, Minister, and my constituency are children. The number of patients currently waiting for initial assessment from a speech and language therapist in the country is 14,501, men, women and children. Now, in Kildare-Wicklow area, there's over 800. In terms of occupational therapy, again, OTs are used for a wide range of rehab and chronic conditions, all sorts of things. A lot of the people who use them have spinal injuries. A lot of children are waiting for occupational therapy. A lot of children with special needs are waiting for occupational therapy. So I took a look at the figures as well. The total number of people waiting for an initial assessment from an occupational therapist in Ireland right now is 32,102. And again, in the Kildare-Wicklow area, it's over 2,800 people. In terms of physiotherapists, there is a chronic shortage of rehab facilities. The National Rehab Hospital does its very best. It is a phenomenal place with phenomenal people in it, but they are screaming out for more beds. They are screaming out for proper step-down facilities. Indeed, I was very involved in one case where a very unfortunate situation occurred, where a fit, healthy young man working out in a gym on the West Coast had an accident in the gym, and when he woke up on the floor of the gym, his spine was fractured. He's quadriplegic, and unless medicine evolves very quickly, that's the prognosis. He got fantastic care in the National Rehab Hospital. He was discharged from memory in September of last year, with people screaming for his bed, with other people who had these huge injuries screaming for his bed. And we managed, in fairness, the HSE, after taking a long time to get going, did finally row in behind it. But I think Andrew got his bed, I think around May. He was sitting in the rehab centre, taking up a bed that someone else needed and not able to go to a step-down facility. And again, when you talk to those in charge of disability services, when you talk to the National Rehab Hospital, when you talk to those running the step-down facilities, they'll say we don't have enough physiotherapists. So I think this is relevant because this bill is a small step in making it easier for qualified physios and OTs and speech and language therapists and a wide range of really important people in our system. It removes one barrier to them being able to do their job. But Minister, the chronic shortage of these professionals, be it speech and language or occupational therapy or radiographers or physiotherapists, it goes on and on and on, obviously, is causing untold pain and suffering around the country, and is depriving in a lot of cases, particularly with kids with special needs, where you've got to get in early and you've got to give them as much early intervention as you can. When it's taken 3.5 years for them to even begin treatment, they are being deprived of leading the best future that they can live. So I know it is not exactly what the bill is about, but it is about these professionals in our country. We need to do a hell of a lot more to keep them. We need to do a hell of a lot more to reward them. We need to do a hell of a lot more to understand how to make their jobs better and more rewarding, and make sure they have the staffing ratios they need, the paying conditions they need, the professional learning environments they need, the training that they need, so that we can keep the fantastic ones that we train here ourselves, but also that we can become a place of choice for employment for these professionals from all over the world. Thank you.